I'm Dr. Doggett at Striegel Animal Hospital. Today we're going to talk about canine dental health, your dog's dental health. Hello, I'm Dr. Doggett at Striegel Animal Hospital, and today we're going to talk about your dog's. Hello, I'm Dr. Doggett at Striegel Animal Hospital. Today we're going to talk about your dog's dental health. I have my assistant Carla with me, and she is going to ask me some questions so that we can get you some more information on dental health for your dog.
Dr. Doggett, how does dental health impact the overall health of my dog?
So, the healthier that our mouth is, the healthier the rest of our body is. It's very, very closely tied to other organ failure. It's very closely tied to other organ health, such as liver and kidney health, and our heart. If we have an infection that sets up in our mouth, that can definitely get into the bloodstream and set up an infection in our heart and cause heart issues. And this is very, very critical for dogs that may already have underlying heart issues. It can make them a lot worse and potentially cause them to go into heart failure if it's severe enough.
How can I care for my dog's teeth at home?
This is a wonderful question. There are so many things that we can do for our dogs. Just simply giving them a dental chew toy is fantastic. That will help, at least with the molars, the teeth in the back that they actually chew with. It will help get that plaque and tartar off every day. It unfortunately doesn't help with the canine teeth or the incisors. So the canines are the long teeth kind of at the side, or the incisors, because they don't chew with those. Those you'll have to take care of with other means, such as a water additive that will decrease the bacteria in their mouth every time they drink their water. You can also do toothbrushing, so it's recommended 5 or more days a week to actually make an impact on the amount of plaque and tartar in the mouth. If you're not doing at least 5 days a week, you're going to do something, but it's not going to be a way to prevent the plaque and tartar buildup. It'll just slow down that progression. And so you can brush with a toothbrush or a finger toothbrush. You always want to make sure you're using pet only toothpaste. Pet toothpaste doesn't have any soap in it that would cause GI issues if they swallow it. So you can start off simply by allowing them to lick the toothpaste off the toothbrush or chew on it. And then when you do the brushing, you're actually only going to focus on the gum line on the outside of the teeth. They don't have flat surfaces like we do to brush, and you don't want to brush on the inside of the teeth at all.
What are some signs and symptoms of dental diseases in dogs?
So it could be as simple as having really, really smelly breath, especially if they come over and lick you and then you smell afterwards. This can mean that they've got an infection in their mouth. So that's just the easiest way. There are a lot of other things. Maybe pain when we're eating, turning our head to one side and only chewing our food on one side, or our toy, only putting our toy on one side to chew and they don't chew on the other side. It can be just general grumpiness. Their mouth hurts just like us. When our mouth hurts, we get grumpy, they do too. And so having them be less tolerant of normal things around the house can just be a sign of pain. Sometimes we see things on our annual exams or every 6-month exams when we look in their mouth that the owners didn't even know about, because the dogs are so good at hiding their pain. And this is really unfortunate, because they can live with pain for a very long time before we notice or do anything about it. So this is another reason why we recommend in older dogs having every 6-month exams, so we can make sure that their dental disease doesn't progress to the point where we are living with pain and having infection in the mouth.
What are some of the common dental diseases in dogs?
So it could be as simple as having plaque and tartar build up to the point where we're losing our gum, which means we have our gums recede and we're having our roots of our teeth exposed. It could be infection in the mouth or a tooth root abscess. In a young dog, it could be a retained puppy tooth that allows food or hair or anything to get in between the adult tooth and the baby tooth, and that can set up a disease around the root of that adult tooth. We can also have teeth that never came out of the gums and are still in the bone. This can set up for cysts or tumors. This is another thing that we like to look for when we look in the mouth and do an oral health exam. We can catch a lot of different types of tumors in the mouth just by doing an exam. Some dogs are very cooperative in the room and we can get a really good oral health exam that way. Some dogs need to have an sedated oral health exam, but we like to make sure that we can make sure that they're
You like to make sure?
yes. We like to make sure that the exam is complete as possible.
Sorry, go ahead.
We like to make sure that the exam is as complete as possible, so we may recommend a sedated oral exam if we feel like there are any problems with your pet's mouth that we can't assess with them awake.
Why is early detection and diagnosis of dental disease so important?
Just like any medical disease, we want to prevent rather than treat. So if we can prevent the need for extractions or catch tumors when they have not caused a lot of issue, or the gum recession before we have a lot of bone loss, or even simply prevent the pain that the dog has from dental disease. Those are some things that we want to do to be preemptive with our dental care instead of catch up after we have the teeth that need to be extracted or the infection in the mouth, or like if we have a fractured tooth because we've been chewing on something like a deer antler or something too hard like a rock or some hard toy that breaks our tooth. We don't want that infection to set up and potentially cause sinus issues or infection going to other parts of the body.
How often should my dog's teeth be checked?
So ideally, you would be brushing your dog's teeth multiple times a week, and you can do just a very, very cursory so ideally you would be brushing your dog's teeth multiple times a week, and this will allow you to see potentially if there's something that is just starting to occur. Other than that, if they're young, we would like to see them at least once a year for exams, even if they're not due for vaccines. And if they're older, we would like to see them twice a year, so every 6 months, so that we can examine their teeth. But again, ideal situation would be you are seeing their teeth multiple times a week as you're brushing.
What's a professional dental cleaning like for my dog?
So it's a lot like our dental procedures with our dental hygienists. The exception is that they are under full anesthesia. Unfortunately, there are some people that need to be under full anesthesia for dentals just because of fear, and it's kind of the same reason for dogs and cats too. So in our dogs, we want to make sure that they're not terrified when we're in their mouth looking around and potentially squirting water in there, doing scaling. Those are some things that most people are okay with, but there are no dogs that really are okay with that. And so under full anesthesia, they have a breathing tube so that when we're squirting water in their mouth to clean their mouth out, we are not going to have them aspirate and get that in their lungs. We are able to do full mouth x-rays to make sure that all of their teeth are healthy. We can do a really good exam of all aspects of their mouth. The gum, the tooth, all sides, under the tongue, the back of the mouth, and make sure that everything is nice and healthy.
So this is where you do the call to action. If you have any questions regarding dog dentistry, give us a call. We are always here for you.
All right. If you have any questions at all, please don't hesitate to reach out to us. We are always happy to educate people and answer any questions you may have about your dog's dental health care or their dental procedures.
Thank you, Dr. Doggett.